video games, academics, sports.
How about all that passive TV watching?
Exactly.
There you go.
Exactly, because it really, the brain's not done yet, and those activities are really sculpting the way that brain is developing. I think we need to really think about that.
So the more you stimulate it growing up till 25, the more capacity it has for the future? Is that the implication?
But it becomes pruned and sculpted to do certain activities. And so I think even the kind of video games make a difference.
Right. The only thing I have to say about that is I think there's also this other school of thought that there's such an overloading of children with activities. They are getting too hyper, they are too overloaded. And is that really the proper thing to do? Because I'm hearing you say, do structure, have activities, but it just seems that there seems to be a little overboard.
Well, everyone needs downtime. But what I'm saying is that for the activities that they do, the choices of activities actually do have an effect on how their brain is developing.
Yeah. Okay. How about doing the dishes, the laundry, and learning how to clean bathrooms? That's my big mantra this summer. Does that work?
I think those are
Does that develop
activities.
the brain? Yeah. No, just a little resentment. No, seriously. What do you do with your kids? I mean, do you, as far as disciplining, like with Michael, I mean, haven't you just seen a big shift?
Yeah, but it's been kind of a cool shift. I mean, he's, starting the business. He's going to Austria. I mean, he's doing some cool things this summer, getting him ready for high school and, giving him some leash and not unlimited leash.
Yeah.
Giving him some ability to take risk and understand it and look at consequences.
To actually experience it.
Exactly.
Yeah. So that's okay to do.
Absolutely.
Between throwing him in the pool and smacking him on the head.
Every now and then. Okay. All right. Thank you so much for joining us.
You.
Really good information.
Thanks.
Fascinating. Okay. Coming up, you're going to be talking about this stuff. What is this called?
Cyberknife. It is so cool. Wait to see the video.
Okay. We'll be back in a minute.
Okay. Thank you.
It was really good. You might be afraid of surgery, but so much is changing to make it much less invasive, and technology is really the reason things are changing. To go under the knife, what does that really mean? That's changed as well. Here to explain the latest in cyberknife surgery is Dr. John Kressel of St. Joseph's Hospital and, of course, Dr. John Shufeldt. This is fascinating.
Yeah, give us the overview about this. Why don't we roll the tape and show it, and as we're showing, you can talk about what's happening.
Sure. Cyberknife stereotactic radiosurgery is a form of bloodless surgery. This is different than some of the other types of modalities that are out there, is that the linear accelerator that produces the radiation therapies on the end of that robotic arm. The robotic arm can move around the patient. There's no head frames or screws. The patient lays on the table. It's done as an outpatient. They don't feel anything.
So no sedation.
No sedation.
They're awake during the whole time. How long does the whole procedure take?
They don't feel anything. The whole procedure for treatment is about maybe 30 to 90 minutes. Here's an actual one that's an older version that's in use. The patient is immobilized with a face mask or a body mold. The imaging is in the ceiling and on the floor there, so we're tracking any patient movement during treatment and compensating for it, so there's no target miss. Our accuracy is less than a millimeter. And we can treat anywhere in the body, which is another new feature of this. This kind of shows how a number of independently targeted beams on a target that represents a tumor or some other structure can be treated completely and then just dissolve or ablate the target.
So you actually focus the different beams of energy all at the same fixed spot, theoretically, or even slightly moving spot.
Right. You want to define your target. It can be a complex shape. It's, tumors are not just circles.
Right.
And whatever that complex shape is, then you want the same volume to be matched that you're going to treat with the high-dose volume. So when you superimpose them, they're exactly the same. So the idea is you're treating only the target. Structures or tissues right next by receive basically no radiation dose and are very safe.
So they're getting the radiation beam through it once, but the tumor's getting it through multiple times from different angles.
Right.
That
it's like,
so cool.
the magnifying glass where you're starting a little fire or something and you're concentrating the sun's beams.
Right.
Same type of thing. We'll use hundreds of different beams focused on one area.
You were saying, Doctor, when we talked before, that you can do this on your lunch hour. This is how immediate it is and quick. Can you actually do that and function? When you think of old forms of radiation, it didn't work that way.
Right.
It hasn't.
Typical treatment is delivered over 1 to 5 days. Typical treatment, quickest we've ever done is 27 minutes. Typically it's about 60 minutes though, but patient comes in, lays down, we immobilize them, set them up, deliver the treatment. They don't feel anything, don't see anything. We have music running so they do hear something.
Side effects?
Side effects is almost nominal, nothing. A little bit of tiredness maybe. It depends on the area of the body that you're treating, but it's done as an outpatient. We don't use any medicines or sedation.
Wow. And where do you think this technology is going to lead? I mean, do you see other applications for it? We talked about kind of burning off a collection of blood vessels called AVMs. Where else do you see it going?
Well, the biggest use is in malignancies, and we've used a number of forms of radiation therapy. I'm a radiation oncologist, and many times the best use is to implant radioactive seeds for different tumors. And give a very concentrated dose in a very precise way. Well, now this gives us a way of doing that without having to invasively place radioactive seeds.
Right.
So we're moving in that direction. It also, as you said, it's useful in some types of disease processes where it's not a malignancy. AVMs or pain issues where you can treat nerve structures that result in pain.
Wow, so you can actually ablate, well, sure, you can, I guess, ablate a nerve with this is causing persistent pain as opposed to injecting it. Oh, that's absolutely amazing.
Are there any specific cancers where this technology is more effective than with others?
Well, right now we're using it most for patients who have no other treatment options. And those are ones where surgery was either incomplete or impossible. So it kind of is an addition to surgery to treat the remaining tumor or the tumor that couldn't be removed. Or in patients who've had previous heavy therapy from other surgeries or radiation or chemo, where before, like many times, they were kind of just told to go home and get their affairs in order. We now have very effective treatments for them.
It's an expensive piece of machinery, I understand.
If you went and tried to buy one at Walmart or Kmart.
And they could have one in Costco in the next 12 months. You never know.
So it's a multi-million-dollar piece of equipment, and the room build-out's got to be multi-million-dollars as well. How many in the state are there?
There's none in the state except ours.
Right. And ours is St. Joe's.
Ours is St. Joe's and Barrows Neurological Institute. We've had the Gamma Knife since '97.
Right.
We treated almost 3,000 patients. Got the most advanced stereotactic radiotherapy component and department in the Southwest, because we're the only one that has both the Gamma Knife and the Cyber Knife basically on this side of the East Coast, and maybe one in California.
Wow, that's exciting technology. Just amazing what you can do and where it's going to go. Thank you very much, Dr. Kressel.
Thanks.
We appreciate it. Good information.
Thanks for
sort
the
of our Top
opportunity.
Doc segment, and we'll be doing more of these on the show. So hopefully we'll have more in the future. Next up, is it wise to pay your mortgage twice a month? True West Credit Union gives us the answer. That's coming up next on Your Life.
Good golly, Miss Molly, sure like the ball. Woo, good golly, Miss Molly.
Ladies and gentlemen, this just in from our presses. Molly is back, and she's a changed woman, literally. Miss Molly underwent surgery last week, and Dr. Mike Ferreira with Squaw Peak Animal Hospital spayed Molly. He is here along with Aunt Rachel and Dr. John just to provide that medical assistance to tell us how it all went. Hello over there.
You know what? Molly is having a good time. She's surrounded by handsome doctors, and they are giving her lots and lots of great attention. Huh, Molly?
What a sweet dog.
You know what? She has the best nature.
You did a great job on the surgery, clearly.
How you doing, Dr. Mike?
Good, how are you?
Good. How's Molly doing?
She seems to be doing great.
And this procedure happened
Last Friday.
So it's been 7 days.
Yes.
You know what? We actually took our cameras out there to take a look at the procedure, but I promise nothing graphic. So let's take a look at Molly having her surgery. Huh, Molly May? There she is with the nurse. And here comes Dr. Mike. And so you're prepping her right now?
We're just getting ready to induce her into anesthesia. We're checking her heart, making sure everything sounds good.
And when should a dog be spayed? How old does a dog need to be?
We usually recommend at 6 months, spay and neutering.
And so it's the same for the male doggies
Same.
too?
Yes.
Now, what if you want the doggie to have puppies first? Can they have a couple litters and then be spayed?
They can, if that's if you wanted to do that. You know, it's a big ordeal for a lot of people, so we don't recommend it. But you can have a couple litters and then have them spayed.
So you should probably make the decision then. And in Molly's case, we've decided no pups for Molly.
Yeah.
Oh, what's happening here?
We're just prepping her for surgery, just shaving her surgical site there.
And so Molly's asleep, but she doesn't feel a thing, right?
She's out cold.
I wonder if she has doggy dreams. Oh, Molly, look, you're in the OR room.
Yep. We're just getting her in the OR. We're going to scrub her up, and
How long does the procedure take, Dr. Mike?
probably takes about 20, 25 minutes.
Oh, that's really quick. And what exactly does it mean to spade a dog?
Spaying is removing both the ovaries and the uterus. So taking out all those parts she doesn't need.
So hysterectomy.
Hysterectomy,
That's
ovariohysterectomy.
Oh, there's Dr. Mike putting on his surgical gown, very official.
Gowning
And
up.
And what's the recovery time?
Typically, they're sore for a few days. Back to activity in about 10 days.
Oh, that's
Week
not
to
too
10 days.
bad.
No,
That's
they're
not too bad. Well, we've missed
bouncing
her.
around.
You know, she
Yeah.
hasn't been here because she was recovering.
Yeah, she was recuperating, but she's bouncing around now.
She is. Now, what happens if a dog goes into heat? Is it too late?
No, you can always spay them. We recommend you spay them before they go into their heat cycle. It's shown that if you wait till after their cycle, they get a increase in the number of mammary tumors and things like that.
Okay, so you should really not wait. Look at that.
Absolutely.
She's on a blanket.
There she is, recovering.
Oh, and it's pink because Molly's a girl.
There she is, waking up.
Oh, Molly.
She
Let's
did
see.
great. No problems. Good patient.
Look at her. What'd she get? Oh, look. She laid her head back down.
Yeah.
How long did it take for Molly to get up after that?
She was probably up and awake. That was probably 15 minutes after
15
surgery.
minutes?
Yeah.
Oh, that's pretty quick.
Yeah, she was good.
Now, because you're here making a house call, would you
Yes.
do me a favor?
Check her out.
Would you check her out and let me know if we can remove, well, let me ask you this. Why the cone head? Why do dogs have to wear
This
that?
lovely thing is to
Molly, well, let's see, remember, off is what we tell her, right, Dr. Mike?
Good
Good
girl.
girl, you did it.
This is to keep her from licking her incision.
Oh, I see,
You
okay.
can't really tell them not to, so they like to lick at it because when it's healing, it itches.
See, that's the hard part, is you can't tell Molly what she just went through and why she's
Bless you.
recovering, but we fed her bonbons, you know. She's been relaxing. Yes, bless you, Molly.
Yes.
All right, well, let's take
Let's
a look.
take a look.
See if we can get her to lay down.
Lay down, Mom.
Molly, down.
Good girl.
Here, I'll get out of the way and let
You're
you do
fine.
your stuff.
All right, her incision looks great.
Oh, good.
Little scabs, not bad. But,
That is a clean incision. What do you think, Dr. John?
Plastic surgery.
Pretty good
You
work.
missed your calling.
yeah.
I love it.
So it looks good. I think we can take her cone off. What do you think, doctor?
You're
Second opinion?
the boss, not for me. You're the boss.
All right.
Never.
Come here,
never-
Mom. Let's
Molly,
take that
good
off.
Never the
news.
animals.
We are going to free Molly, folks, right here, right
she'll
now.
be so excited. So
Molly,
she's worn that for a week?
7
She has.
days.
Wow.
And I felt sorry for her, you know, because she tries to scratch
Yeah.
and tries to take it off. But she's really been a good sport, I have
Oh,
to
she's
say.
a doll.
Look at that. Look at her little face. It's coming off, Molly. You are free.
You're free.
We should have had a drum roll. Yay, Molly. Yay. All better
happened?
now. Good girl, Molly. So can she resume her normal activities
She
now,
can. She
7
can
days
start
later?
walking and playing and doing all that stuff that she
Oh,
did before.
good. Now, after the surgery, what does the doggy's owner have to do to help her recover smoothly?
Mostly just keeping her quiet,
Mm-hmm.
keeping her from licking at it with the Elizabethan collar, and making sure that incision's looking good.
Heidi, come see
I
Molly.
think some people could wear this, by the way. Now, John, you're awfully quiet. Now, you operate
I'm
on
shocked.
people.
I could never have gotten into vet school. It was a lot harder to get into medical school. So
Was
this
it?
is, and we have no cone heads. So I mean,
I know.
I want to do it just for that.
Yeah, now, he wants this back.
No, she. Heidi.
A sheep.
Her
Why
name
do I
is
think-
Molly?
Molly.
Molly, you know what? We have got
It's a
to
blonde.
go.
It's a blonde. It's a blonde thing.
They're both
Here,
blind.
catch that
Heidi's
thing.
going to get you.
Stop that. No way.
Now, Molly thinks it's a toy now.
Yep.
Oh, great. I've
wants to
now
get
messed up the whole training, too.
No, it's
No, I know you've
It's okay.
bonded with Molly.
Blonded?
Bonded.
I'm sorry. I thought you bonded with Molly.
Bonded.
I'm sorry.
Well, you know what? Molly likes hairy legs. Okay. So seriously, as far as recovery, I just have one quick question. As far as any kind of complications, anything like that, is she good to go?
She is good to go.
Will she be crabby for a while? Because you never know. Or
Teenage brain.
Exactly, temperamental. No, the toddler
Short
brain.
attention span, but no, she's doing great. Free to do whatever she wants.
You know, is she in her teenage years now? That's a good
Yep.
point. That's what I thought.
She's an adolescent.
Oh,
So
that's right.
she's like
7
13.
times.
Mm-hmm.
No. No,
Is that
she's,
not true? Dogs
No.
years are
7 years? That's what I thought. Tell us the
learned
truth,
something
Dr.
new
Munch.
today.
she's barely a year. Wait a
It
minute.
depends on the breed.
Okay, and Molly's breed,
She's a teenager.
Golden Doodle. You're a teenager. We survived terrible twos, that means.
Wow.
Yeah.
We did it, Heidi.
No, yeah, you've got little ones. Wait till you do adolescence. Okay.
Yeah, I'm afraid of that.
Molly's a teenager. Yahoo! Okay, but she doesn't have the cone, so that's a good
No more cone.
No more cone heads.
Oh, if
Okay.
you want to borrow it, we've got it right over here.
Well, you know what? It is
Keep
gonna
safe.
that little need. Okay.
Kinda nice.
Molly,
Anyway.
can you say thank you to Dr. Mike? He took
Oh.
good care of you.
Now, how does the dog say thank you?
Just like this. See? There you go. Look at the
Oh.
love. Look at that.
Oh, sweet dog.
Molly, good
Good
girl.
girl.
Okay. Well, anyway, hey, thank you very much,
You're
Doctor.
welcome.
Thank you,
Yeah,
Dr.
yeah.
John, for all that input. Rachel, as usual,
I'm a
always
proud
a
aunt.
pleasure. I know you are. She's in love. Hey, next, heart music to help hospice patients. We'll tell you about music therapy and listen to some beautiful soulful music as well coming up next.